Module 3, Clinical Conditions, Infections, HIV, AIDS, and Reproductive Health Education. In this final module, we explore gynecological conditions, reproductive tract infections, HIV, AIDS, harmful traditional practices, and strategies for reproductive health communication and education. Gynecological conditions. Vulva includes inflammation, vulvitis, cysts, tumors, and varicose veins. Nurses assess symptoms such as itching, swelling, or discharge and implement hygiene practices and medication. Vagina, inflammatory conditions, vaginitis, congenital abnormalities, and fistulae, vesicovaginal and rectovaginal. Management involves maintaining hygiene, surgical repair, and psychosocial support. Cervix, common issues include cervicitis, polyps, erosion, and cervical cancer. Regular screening via pap smear and HPV vaccination are critical preventive strategies. Uterus includes endometritis, endometriosis, fibroids, and uterine cancer. Nurses play a role in symptom monitoring, preparing patients for imaging and surgical procedures, and providing emotional support. Fallopian tubes, salpingitis, ectopic pregnancies, and structural abnormalities impact fertility. Early diagnosis and prompt treatment are essential to prevent complications. Ovaries, ovarian cysts, inflammation, and cancer require careful monitoring, imaging, and often surgical intervention. Pelvic floor, conditions such as uterine prolapse, cystocele, and rectocele result from weakened pelvic muscles. Management includes pelvic exercises, pessary use, or surgery. Pelvic inflammatory disease, PID, a result of untreated STIs leading to severe pain, fever, and infertility. Nurses provide antibiotics and patient education on STI prevention. Breast conditions include mastitis, abscesses, fibrocystic changes, and breast cancer. Nurses teach breast self-examination, BSE, and assist with diagnosis and treatment. Investigations and procedures. Diagnostic tests, ultrasound, abdominal, transvaginal, blood work, pap smear. Surgical interventions, dilation and curettage, D&C, hysterectomy, myomectomy, salpingectomy, oophorectomy, mastectomy. Nursing role, pre-op and post-op care, vital signs monitoring, wound care, patient education, emotional support. Reproductive tract infections and infertility. Sexually transmitted infections, STIs. Nurses educate about and manage 7 major syndromes including urethral discharge, genital ulcers, vaginal discharge, and pelvic pain. Counseling is key for partner notification and adherence to treatment. STI prevention, condom use, regular screening, abstinence, and mutual monogamy. Adolescents and youth require tailored interventions. Infertility affects both males and females. Causes include hormonal imbalances, blocked fallopian tubes, poor sperm quality, and infections. Nurses support diagnosis and treatment, which may include assisted reproductive technologies. Sexual dysfunctions, these include erectile dysfunction and female arousal disorders. Nurses provide emotional support, sex education, and referrals to specialists. HIV/AIDS management. Pathophysiology, HIV attacks CD4+ T cells, weakening immunity. It progresses to AIDS when the immune system fails. Laboratory diagnosis includes ELISA, Western blot, and viral load test. WHO staging guides clinical assessment from stage 1 asymptomatic to stage 4 AIDS. Prevention, ABCD model, abstinence, be faithful, condom use, do not share needles, universal precautions, and post-exposure prophylaxis, PEP. HIV counseling and testing, HCT voluntary and confidential testing services help early diagnosis and management. Prevention of mother-to-child transmission, PMTCT includes antiretroviral treatment during pregnancy, safe delivery, and infant feeding counseling. Antiretroviral therapy, nurses monitor adherence, side effects, and treatment efficacy. Nutritional support, family involvement, and opportunistic infection management are critical. Sexuality and reproductive health for PLWH includes counseling, contraception access, safe conception, and stigma reduction. Issues in reproductive health. Harmful traditional practices include female genital mutilation, FGM, early and forced marriage. These practices cause physical and psychological harm. nurses advocate for their elimination through education and community mobilization. Sexual and domestic violence, nurses must screen, support, and refer survivors of physical and sexual abuse. Ensuring privacy, empathy, and legal documentation is essential. Information, education, and communication, IEC. Advocacy, engaging policymakers and traditional leaders to support reproductive health initiatives. Community mobilization, conducting outreach programs, sensitization campaigns, and forming community support groups. Communication strategies, using posters, radio, social media, and drama to disseminate RH messages. Health education and counseling, nurses provide one-on-one or group sessions addressing contraception, STI prevention, prenatal care, and more. This concludes Module 3 and our comprehensive course on reproductive health care. Thank you for your commitment to improving knowledge and practice in this vital field of nursing.